I need to tell you about the promise I broke to a dying man, and how that broken promise brought him back from the dead for 5 years. My name is Sarah. I'm an ER nurse, and 3 nights ago, I finally kept the promise I made to Marcus Thompson in October 2018. Marcus died in my arms that night. Car accident, Route 287. His last words were, "Tell my wife I tried to make it home for dinner." I never made that call. What happened next, what Marcus did to get that message delivered, will haunt me for the rest of my life. Every Friday night for 5 years, at exactly 11:47 p.m., Marcus came back. Same injuries, same desperation to get home, same man who should have been dead, and I was the only one who could see him. This is the story of how a broken promise can trap a soul between worlds, and how love, real love, can transcend death itself. But I have to warn you, after tonight, you'll never look at emergency rooms the same way again. Before I tell you about Marcus, understand who I am. Sarah Chen, Metropolitan General Hospital's Level 1 Trauma Center. 12 years of emergency medicine, over 3,000 cases. I've performed CPR until my arms gave out. I've held dying patients' hands when families couldn't make it in time. I don't believe in ghosts or supernatural things. I'm a woman of science. I believe in evidence, in what I can measure and document. My colleagues know me as the nurse who stays calm during codes, who thinks rationally under pressure. That credibility matters, because what happened with Marcus challenged everything I thought I knew about reality. Metropolitan General sits right off Interstate 95. Friday nights are brutal. Drunk drivers, speeders, teenagers being reckless. Fatal accidents are routine. I'd been working night shifts for 7 years when Marcus first appeared. Friday nights had become predictable. Multiple traumas, grieving families, controlled chaos. That October Friday started normal. Few minor injuries, 1 heart attack we stabilized quickly. I remember thinking it was quiet for a Friday. In emergency medicine, quiet means something big is coming. I just never imagined it would last 5 years. 11:43 p.m. The call came in, single vehicle accident, Route 287. Male driver, mid-30s, massive trauma from high-speed collision. ETA 4 minutes. High-speed crashes rarely end well. The paramedic's tone told me everything. This would be bad. Dr. Rodriguez was attending. 20 years of experience, someone I trusted completely. We prepped Trauma Bay 3 and waited. At exactly 11:47 p.m., they brought him in. Marcus Thompson, mid-30s, African-American, about 6 feet tall, extensive trauma, head injuries, chest damage, probable internal bleeding. But he was conscious, alert, talking. That was the first impossibility. "Please," he said, grabbing my hand with surprising strength. "Help me get home. My wife is waiting for dinner." His voice was clear, coherent. No confusion, but his injuries should have been instantly fatal. "Sir, you're at Metropolitan General," I told him. "You've been in an accident. We're going to take care of you." His grip was warm, real. "I need to get home. Lisa's making my favorite dinner. I promised I'd be there by midnight." Dr. Rodriguez began his examination. That's when things got impossible. No blood pressure, no detectable pulse, body temperature dropping rapidly. But he was still talking, still responsive, still desperate to get home. "What's his name?" Dr. Rodriguez asked the paramedics. "Marcus Thompson, age 34. Accident at 11:15 p.m., Route 287 southbound. Vehicle struck barrier at approximately 70 miles per hour." Dr. Rodriguez and I exchanged glances. A patient with no vital signs who was having a conversation with us? Medically impossible. We spent an hour trying to stabilize him, but nothing made sense. Every test confirmed fatal injuries. But Marcus kept talking about his wife, about dinner, about getting home. Then, at exactly 12:47 a.m., he stopped mid-sentence. No gradual decline. One moment asking about calling his wife, the next, nothing. Time of death, 12:47 a.m. Here's what bothered me for days. When we contacted Marcus Thompson's emergency contact, his wife Lisa told us Marcus had died in a fatal car accident 5 years earlier. Same location, same time. She said he died instantly. I convinced myself it was a mistake. Wrong records, mixed up information. But something felt wrong. Until the next Friday night. The following Friday, I watched the clock. 11:30 p.m. came and went. I told myself I was being paranoid. At 11:43 p.m., my phone rang. Single vehicle accident on Route 287. Male driver, mid-30s, high-speed collision with concrete barrier. ETA, 4 minutes. The words were identical, exactly identical. My blood went cold, but I forced myself to stay rational. Same stretch of road, similar accidents happen. We prepped Trauma Bay 3. Same setup, same protocol. But I couldn't shake the feeling I'd done this before. At exactly 11:47 p.m., they brought him in. Marcus Thompson. Same injuries. Same impossible consciousness despite fatal trauma. "Please," he said, looking at me with identical urgency. "Help me get home. My wife is waiting for dinner." The words, the tone, even how he grabbed my hand, everything was exactly the same. Dr. Rodriguez didn't recognize him. When I tried to mention it, he gave me a strange look. "Are you feeling all right, Sarah?" I had a choice. Insist this was the same patient and risk my career, or stay quiet and investigate myself. I stayed quiet. This time, I documented everything. Injury patterns, exact words, timestamps, how he held my hand. Marcus went through the same routine. Asking about his wife, confusion about the accident, concern about being late. At exactly 12:47 a.m., he stopped talking and was pronounced dead. After my shift, I went to records. According to our system, there was no Marcus Thompson treated the previous Friday. No admission record, no death certificate, nothing. But I knew what I'd seen. I spent the weekend researching hallucinations, stress-induced psychosis, occupational burnout. Convinced myself I was experiencing delayed stress reaction. But I wasn't hallucinating. Marcus was real. I requested different shifts for 3 weeks. No Marcus Thompson, no impossible patients. I started to relax. Maybe it was stress. Maybe changing routines broke the psychological pattern. But I had to return to night shifts eventually. My first Friday back, I was on edge all evening. 11:43 p.m. came and went. No call. By midnight, I felt foolish. Whatever happened was clearly over. Then the following Friday, at 11:43 p.m., the call came. Marcus Thompson was back, and this time I was ready to find out what he wanted. The third time Marcus appeared, I was prepared. Notebook ready, questions planned, determination to understand what was happening. When they brought him in at 11:47 p.m., I looked into his eyes and saw genuine confusion. This wasn't a hallucination. This was a man who thought he was late for dinner. "Marcus," I said, trying a different approach, "what year do you think it is?" He looked confused. 2018, of course. Why would you ask that? 2018, the year of his original accident. What's the last thing you remember? Leaving work. Patterson Construction finished the Morrison project early. Mr. Patterson let us go at 11. I called Lisa. She was so excited I'd be home for dinner. She made pot roast with those little potatoes I like. His voice broke. She's probably worried sick. How long have I been here? About 15 minutes. 15 minutes? I can still make it home by midnight if I can just call her. I documented everything. Work details, personal information, memories, all consistent with someone whose last memory was from 2018. For an hour, I split attention between medical procedures and conversation. Marcus painted the picture of a man who had no idea he'd been dead for 5 years. At 12:45 a.m., Marcus suddenly looked directly at me with startling clarity. "You're different tonight," he said quietly. "The other times you just followed routine, but you're really listening." My blood froze. "Other times?" Before he could answer, his eyes closed. Time of death, 12:47 a.m. He knew. Marcus knew this had happened before. After my shift, I drove to Oak Street. I had to see for myself. 12:47. Oak Street was a small apartment building. I sat outside for 20 minutes, building courage. Finally, I knocked on apartment 4B. The woman who answered was early 30s, blonde, wearing a bathrobe. She'd been crying. "I'm Sarah Chen, a nurse at Metropolitan General. I know this sounds strange, but I wanted to ask about your husband, Marcus Thompson." Her face went white. "Marcus? What about Marcus?" "This will be difficult to hear, but I believe I've been treating your husband in our emergency room." Lisa invited me inside. The apartment was exactly as Marcus described, cozy, filled with photos of a happy couple, but everything was dusty, untouched for years. "Marcus died 5 years ago," Lisa said quietly. "Car accident on Route 287. He was coming home early for dinner. I'd made pot roast." She started crying. "He called at 11 p.m. to say he was leaving work, said he'd be home by midnight. I waited until 2 a.m. before calling police." I showed her my notebook with details Marcus had given me, his work, their plans, how he liked his coffee. "How do you know all this?" she whispered. "Because he told me. Tonight, and other Friday nights." Lisa stared at me, then pulled out a photo from their wedding day. Marcus was exactly as I remembered. Same face, same smile. "I never told anyone," Lisa said, "but sometimes I still set a place for him at dinner. Every Friday night, I make pot roast and wait until midnight." That's when I understood. Marcus wasn't appearing randomly. He was trying to get home. Every Friday, reliving the same journey, trying to complete the trip death had interrupted. But why was I the only one who could see him? I was about to discover my connection to Marcus went deeper than I'd imagined. I became obsessed with understanding why I was the only one who could see Marcus. I went through my memories of October 13th, 2018, the night of his original accident. Then it hit me. I pulled my old work schedules. October 13th, 2018. I had worked that night. I called records and asked for archived files from that date. It took 3 days, but they found it. Marcus Thompson, age 34, DOA from vehicle accident, Route 287. Time of arrival, 11:47 p.m. Time of death, 11:52 p.m., 5 minutes. He'd lived exactly 5 minutes. And I had been his primary care nurse. I stared at the file, forcing myself to remember. 5 years ago, during the busiest period of my career. Double shifts, staffing shortages, overwhelming caseloads. Slowly, the memory returned. Marcus had arrived during a multi-vehicle accident that brought in 6 patients simultaneously. Pure chaos, running from room to room, making life or death decisions every minute. Dr. Martinez immediately classified Marcus as non-survivable. In triage terms, a black tag, beyond medical help. But Marcus was conscious. I remembered now. He'd grabbed my hand. "Please," he'd said, "tell Lisa I tried to make it home for dinner." I'd promised I would call her. But then all 6 accident patients started coding simultaneously. Impossible choices about resource allocation. By the time I got back to Marcus, he was gone. I never called Lisa. In the chaos, the exhaustion, the overwhelming nature of multiple traumas, I forgot my promise to a dying man. I'd broken the last promise Marcus Thompson ever heard. Sitting with his file, I finally understood. Marcus wasn't just trying to get home. He was trying to complete unfinished business between us. The 4th Friday, I was ready to tell him the truth. But when I looked into his confused, hopeful eyes, I couldn't do it. How do you tell someone they've been dead for 5 years? How do you explain their final request was never fulfilled? Instead, I lied. "Marcus, I called your wife. Lisa knows you're here. She knows you tried to make it home." His face lit up with relief. Really? What did she say? She said she loves you. The pot roast can wait. She just wants you to be okay. Marcus smiled, the first genuine smile I'd seen. That sounds like Lisa. She always worries more about me than the food. But my lie didn't help. Marcus still disappeared at 12:47 a.m., still returned the following Friday with the same confusion. Lying wasn't the solution. The fifth Friday, I made a different choice. Instead of treating Marcus medically or lying about his situation, I decided to really listen. "Tell me what you want to say to her," I said. "I'll make sure she gets the message." Marcus looked at me with such gratitude, I almost cried. "Tell her I'm sorry I'm late. Tell her the pot roast smells amazing. Tell her I love her more than all the stars in the sky. That's what I used to say when I worked late." He paused, thinking. "And tell her about the surprise. In my work jacket pocket, there's a jewelry box. I was going to propose tonight. We've been talking about marriage for 2 years, and I finally saved enough for the ring she deserves." My heart broke. According to records, Marcus and Lisa were already married, but in his mind, he was still living in the moment before he could propose. "Tell her yes," Marcus continued. "Whatever her answer is, tell her mine is yes. Yes to the wedding, yes to the house, yes to kids, yes to everything, as long as it's with her." I wrote down every word. "One more thing. Tell her I'm not scared. When I saw the barrier coming, I wasn't thinking about the accident. I was thinking about coming home to her, about how lucky I am to love someone who makes pot roast just because I had a hard day." At 12:47 a.m., Marcus took my hand one last time. "You'll tell her?" "I promise." Marcus smiled, closed his eyes, and let go. That weekend, I drove back to Lisa. But this time, I wasn't going to ask about Marcus. I was going to deliver a message 5 years overdue. Standing outside Lisa's apartment that Saturday, I held Marcus's message and tried to figure out how to explain the impossible. Lisa answered looking tired, sad, like someone carrying grief too long. "Sarah, what are you doing here? I need to tell you something that will sound impossible, but listen to the whole story before you decide I'm crazy." I told her everything. Marcus's visits, his confusion about time, his desperate need to get home, his message. Lisa listened without interrupting, her face cycling through disbelief, hope, fear, and finally acceptance. "I knew something was happening," she said quietly. "Every Friday for 5 years, I felt like Marcus was trying to come home. I couldn't explain it, but I could feel him." She went to her bedroom and returned with a small wooden box. "I found this in his work jacket after he died," she said, revealing a simple but beautiful engagement ring. "I never understood why he had it. We were already married." I stared at the ring, remembering Marcus's words about proposing. "Lisa, in Marcus's mind, he's still living in the moment before your engagement. He remembers loving you, wanting to marry you, but not that you already said yes." Lisa started crying. "He proposed 3 years before he died. Friday night, came home early with this ring and a speech about growing old together. He's been trying to recreate that night, coming home early, dinner waiting, ring in his pocket. He's stuck in the moment before he could ask you to be his wife." Lisa looked at the ring for a long time. "What does he need?" "I think he needs to hear your answer. The answer you gave 3 years before he died, but can't remember because he's trapped in an earlier moment." That Friday, I did something unprecedented. I arranged for Lisa to come to the hospital. I'd explained to Dr. Rodriguez that we had a grieving widow needing closure about her husband's final moments. He agreed to let her observe. At 11:43 p.m., the familiar call came in. When Marcus arrived at 11:47 p.m. and asked me to call his wife, I had a different answer. "Marcus, I don't need to call her. She's here." I brought Lisa into the trauma bay. The moment she saw Marcus, she gasped. Dr. Rodriguez couldn't see him. To everyone else, I was talking to an empty gurney. But Lisa could see him. "Marcus?" she whispered. He turned toward her voice, his face lighting up with pure joy. "Lisa, you're here. But what about dinner?" "Marcus," Lisa interrupted gently, "dinner doesn't matter. Nothing matters except this moment." She took his hand. I watched them look at each other across 5 years of separation. "Do you remember what you wanted to ask me tonight?" Marcus's eyes cleared, and for a moment he seemed to remember everything. The ring, the proposal, the life they'd planned. "Lisa," he said, "will you marry me?" Lisa smiled through tears. "Marcus Thompson, I have been married to you in my heart for 8 years, in this life and the next. Yes, I will marry you. Yes to everything. Yes to forever." Marcus smiled the most peaceful smile I'd ever seen. "I love you more than all the stars in the sky." "I love you more than all the space between them," Lisa replied. Marcus squeezed her hand. "I'm sorry I'm late for dinner." "You're not late. You're exactly on time." At 12:47 a.m., Marcus closed his eyes and let go. But this time, there was no confusion, no fear, no desperate need to get home, only peace. Dr. Rodriguez later called it the strangest case he'd worked, a patient with no vitals who seemed to respond to comfort measures for over an hour. But I knew what had happened. Marcus had finally completed his journey home. Lisa and I sat afterward, emotionally drained, but somehow lighter. "Will he come back?" she asked. "No," I said with unexplainable certainty. "He's home now." The following Friday night came and went without calls about Route 287 accidents. No impossible patients, no Marcus Thompson trying to get home. 3 months later, Lisa visited me at the hospital. She looked different, lighter, more at peace. "I wanted to thank you," she said, handing me a wrapped package. Inside was their wedding photo. On the back, "Thank you for helping him come home. Thank you for keeping your promise." "I'm moving to Portland," Lisa told me, "starting fresh. I'll always love Marcus, but I finally feel like I can move forward." "What changed?" That night, when Marcus and I said goodbye properly, it was like we finally finished our conversation. For 5 years, I felt like he was still out there, still trying to get home. Now I know he made it. After Lisa left, I looked at their wedding photo. 2 people who loved each other so much that death couldn't break their connection. But I also thought about my role. If I hadn't forgotten to call Lisa 5 years ago, would Marcus have been at peace from the beginning? I'll never know. But I learned something about death and love and unfinished business. Sometimes people can't let go because they love too much. Sometimes the living can't move forward because they're holding too tight. Sometimes it takes 5 years and a kept promise to help both sides find peace. Marcus taught me that death isn't always the end of the story. Sometimes it's just a comma, waiting for the rest of the sentence to be written. And sometimes you get to help write the ending. That was 7 years ago. Marcus Thompson was the first patient who taught me that emergency medicine isn't just about saving lives. Sometimes it's about helping souls find peace. After Marcus, I started paying attention to patients who lingered, ones with unfinished business, ones who couldn't quite let go. I realized I'd encountered others like Marcus, patients with impossible injuries who remained conscious just long enough to deliver a message. Patients who defied medical explanation in their final moments. I'd dismissed these as medical anomalies, but Marcus opened my eyes to a different possibility. What if some people don't cross over immediately? What if love, guilt, or unfinished business can anchor a soul to this world? I started documenting these cases differently, not just symptoms and treatments, but personal details. What patients said, who they asked about, what messages they wanted delivered. And I started following through on promises other nurses might forget in the chaos. Maria Santos kept asking about her daughter's quinceañera dress. I tracked down her daughter and learned Maria had been secretly saving for 2 years to buy the perfect dress. Her daughter had been heartbroken, thinking her mother died without knowing how much the celebration meant to her. I told her about the hidden savings account and Maria's detailed notes. Robert Chen mumbled about the letter in the toolbox. His son had thrown away what he thought was junk. But I mentioned the letter, and his son remembered finding an envelope marked, "For Tommy." Inside was a handwritten letter from Robert explaining why he'd been hard on his son, expressing pride he'd never voiced, asking forgiveness for prioritizing work over family. 16-year-old Ashley Williams died in a prom night car accident, but kept asking if someone could fix her hair before her boyfriend saw her. Seemed trivial for someone with fatal injuries. But I learned Ashley had battled cancer for 2 years, lost her hair during chemo, and just started growing it back. Prom was the first time in 2 years she'd felt beautiful. Each patient taught me something about the intersection of medicine and the human soul. They all needed someone to bear witness to their final thoughts, to ensure their concerns were addressed, to help complete unfinished business. Not all involved the supernatural. Most were about human connection and finishing conversations before it's too late. But occasionally, once or twice a year, I encounter someone like Marcus, someone operating outside normal rules of life and death, someone holding on through pure force of will and love. David Park arrived after a massive heart attack with no chance of survival. He stayed conscious 3 hours, far longer than medically possible, because his wife was in labor across town. David died at 2:47 a.m., 17 minutes after his daughter was born. His wife later said she felt overwhelming peace at exactly 2:47 a.m., like someone whispered everything would be okay. Eleanor Rodriguez, 93, survived a stroke that should have been fatal. She remained alert 6 days, long enough for her great-grandson to return from deployment. Eleanor had raised him after his parents died. She died peacefully in his arms 2 hours after he arrived. These experiences changed how I practice medicine. I advocate for family presence during end-of-life care. I keep a notebook for patients' final messages. I follow up with families to deliver those messages. My colleagues noticed the change. Some thought I was becoming too emotionally involved. Others said I was spending too much time on non-medical concerns. But Dr. Rodriguez understood. "You're helping them complete their stories," he told me after we lost a patient who held on just long enough to hear his daughter's voice. Medicine can't always cure the body, but sometimes we can heal the soul. We developed what we called the completion protocol, practices to help dying patients address unfinished business, available phones for final calls, extended visiting hours, documentation of final requests with follow-up. Other nurses adopted similar practices. Metropolitan General developed formal policies around end-of-life communication and family support. But for me, it all traced back to Marcus and the promise I'd forgotten to keep. Guilt can be a powerful teacher. My guilt over failing Marcus made me hypersensitive to similar situations. I never wanted another patient to die with an undelivered message. I've delivered hundreds of final messages since then, helped complete dozens of unfinished conversations, connected dying patients with estranged family members, resolved decades-old conflicts, ensured final words of love reached those who needed to hear them. These patients taught me that healing isn't always about medicine. Sometimes healing is about love, forgiveness, completion, and peace. Emergency rooms aren't just places where bodies are repaired. They're places where souls sometimes make final preparations for whatever comes next. I still work night shifts at Metropolitan General. I still treat accident victims, heart attacks, all the traumas that come through our doors. But now I understand my job isn't just saving lives. Sometimes it's helping people die well. Sometimes it's ensuring final messages reach recipients. Sometimes it's being present for the most important conversation someone will ever have. Every Friday night, setting up trauma bays and preparing for whatever cases might come, I think about Marcus Thompson. His love for Lisa, his determination to get home, his need to propose one more time. I think about 5 years he spent trapped between worlds, reliving the same journey, trying to complete the most important moment of his life. And I think about the night he finally made it home. Marcus taught me that love doesn't end with death. Sometimes love creates bridges between worlds, connections that transcend medical explanation. He taught me that promises matter, especially ones made to dying patients in emergency medicine chaos. Most importantly, he taught me that sometimes the most crucial thing a healthcare provider can do is listen, bear witness, and help complete the stories that matter most. I never saw Marcus again after that night with Lisa, but I carry his story every time I enter the ER. His story reminds me to pay attention to patients holding on for reasons beyond medical explanation. Because sometimes they're not just fighting for their lives, sometimes they're fighting for love. And sometimes, if you're there at the right moment, you get to help love win. That's Marcus Thompson's story. The patient who taught me emergency medicine is about more than saving lives. It's about honoring the human spirit, completing unfinished business, helping souls find peace. Behind every medical case is a human story. Sometimes those stories need an ending only love can write. Marcus got his ending. He got to go home. In helping him complete his journey, I learned healing comes in many forms. Sometimes healing looks like stopping a heart attack. Sometimes healing looks like helping a man propose to his wife one more time, 5 years after death separated them. Both are sacred work. Both are why I became a nurse. The next time you're in an emergency room, remember Marcus's story. Remember that sometimes people need more than medical treatment. Sometimes they need someone to listen to their final words. Sometimes they need someone to keep a promise. Sometimes they need someone to help them get home. Thank you for listening to Marcus's story. If you're ever in a position to help someone complete their story, remember these moments matter. They matter more than anything. Because in the end, we're all just trying to get home.